I'm Dr. Grunfeld. So I'd like to talk to you about when is the right time to think about making the transition to an egg donor. Obviously, everybody wants to conceive with their own eggs, and we make every effort to help you to parent using your own eggs, but there are times when you may feel that your own eggs might be challenged and it may be time to move on to a different source of eggs. We have some medical tests that may help you in that regard. We routinely check everybody for their ovarian reserve, and that's usually a combination of 3 different tests. It's the baseline antral follicle count, which is a sonogram to see how large your ovaries are, the older day 3 FSH level, which is done to see if your pituitary is working particularly hard to drive your ovary, and the more modern anti-Mullerian hormone, or AMH level. When you have small ovaries, an elevated FSH, and a decline in your AMH level, it means that there are not a lot of eggs left in your ovary. You may not be aware that you're born with all the eggs you're ever going to have, and as you get older, you deplete that source of eggs, and you're left with a small reserve of eggs. How good are the last few eggs that you have in your ovary? Most women go through menopause in their early 50s, some in their late 40s. Most women follow their mom's pattern, and if your mom went into her menopause in her mid-40s, you might also be going into menopause in the mid-40s. But you may not be aware that there's about 10 years before menopause where you're left with the last few eggs in your ovary that are often of poorer quality. Fortunately, with modern in vitro fertilization, we can check your eggs to see if they're viable. Oftentimes, a couple or a patient might go through IVF and have her embryos looked at genetically to see if they're normal. And the good news is that no matter how old you are, if you have a normal embryo, your chance of getting pregnant with that embryo is very good. The problem is that as you get older, you have fewer eggs left, and more of those eggs are abnormal. You can almost plot a straight line on a curve where you look at your age on the bottom and your chance of having a normal egg on the top, and that declines in a straight line after 35, where at 44, more than 90% of the eggs you make are going to be chromosomally abnormal. Furthermore, after 44, there are fewer eggs in the ovary to work with. So we have fewer eggs and fewer normal eggs. So we may not get a normal egg for you. If you've tried repeated attempts at IVF and none of the eggs are normal, you might want to consider switching to a different egg source from somebody who has more fertile eggs than you are able to create. We have some relative criteria for making that transition. One is women over 45, while we do accept them into our IVF center and we do allow them the opportunity to check their embryos to see if they're normal, they often have all abnormal embryos. And women over 45 should start considering the use of a different egg, particularly if they have had an IVF experience where all the embryos were abnormal or the eggs wouldn't grow. If you have a very high FSH or a low AMH is a relative criteria. That's really a test of how many eggs you have left in your ovary, not the test of how good your egg quality is. If you're young but you have a slightly elevated FSH, you're not going to make as many eggs as somebody else, but you might have very good quality embryos, so that would not be a reason to go straight into egg donor. Another criteria for going to an egg donor is you've just gotten exhausted with all the treatments. You just tried too many things and everything is pointing as the eggs as being the source of the problem, and switching eggs might help you there. What about somebody who gets pregnant very easily but miscarries? Well, the most important test you can do if you're miscarrying is to test the embryo that miscarried to see if it was the source of the problem. Oftentimes patients